Hi everybody, this video of mine is about hypothyroidism. This is a condition in which your thyroid gland does not produce enough of certain crucial hormones. Hypothyroidism may not cause noticeable symptoms in the early stages. Over time, untreated hypothyroidism can cause a number of health problems such as obesity, joint pain, infertility, and heart disease. Accurate thyroid function tests are available to diagnose hypothyroidism. Treatment with synthetic thyroid hormone is usually simple, safe, and effective once you and your doctor find the right dose for you. Now I'll tell you the symptoms. The signs and symptoms of hypothyroidism vary depending on the severity of hormone deficiency. Problems tend to develop slowly, often over a number of years. At first, you may barely notice the symptoms of hypothyroidism, such as fatigue and weight gain, or you may simply attribute them to getting older. But as your metabolism continues to slow, you may develop more obvious problems. Hypothyroidism signs and symptoms may include fatigue, increased sensitivity to cold, constipation, dry skin, weight gain, puffy face, hoarseness, muscle weakness, elevated blood cholesterol level, muscle aches, tenderness and stiffness, pain, stiffness or swelling in your joints, heavier than normal or irregular menstrual periods, thinning hair, slowed heart rate, depression, impaired memory, and large thyroid gland, which is also known as goiter. Now I'll tell you something about hypothyroidism in infants. Although hypothyroidism most often affects middle-aged and older women, anyone can develop the condition, including infants. Initially, babies born without a thyroid gland or with a gland that does not work properly may have few signs and symptoms. When newborns do have problems with hypothyroidism, the problems may include yellowing of the skin and whites of the eye, that is known as jaundice. In most cases, this occurs when a baby's liver cannot metabolize a substance called bilirubin, which normally forms when the body recycles old or damaged red blood cells. A large protruding tongue, difficulty breathing, hoarse crying, and umbilical hernia. So these are also features of hypothyroidism in infants. As the disease progresses, infants are likely to have trouble feeding and may fail to grow and develop normally. They may also have constipation, poor muscle tone, excessive sleepiness. When hypothyroidism in infants is not treated, even mild cases can lead to severe physical and mental retardation. Now I'll tell you something about hypothyroidism in children and teens. In general, children and teens who develop hypothyroidism have the same signs and symptoms as adults do, but they may also experience poor growth resulting in short stature, delayed development of permanent teeth, delayed puberty, poor mental development. You should see your doctor if you are feeling tired for no reason or have any of the other signs or symptoms of hypothyroidism such as dry skin, a pale, puffy face, constipation, or a hoarse voice. If you are receiving hormone therapy for hypothyroidism, schedule follow-up visits as often as your doctor recommends. Initially, it is important to make sure you are receiving the correct dose of medicine, and over time the dose you need may change. Now I'll tell you the causes of hypothyroidism. When your thyroid does not produce enough hormones, the balance of chemical reactions in your body can be upset. There can be a number of causes, including autoimmune diseases, hypothyroidism treatments, radiation therapy, thyroid surgery, and certain medications. Your thyroid is a small butterfly-shaped gland situated at the base of the front of your neck, just below your Adam's apple. Hormones produced by the thyroid gland, triiodothyronine, that is T3, and thyroxine T4, have an enormous impact on your health, affecting all aspects of your metabolism. These hormones also influence the control of vital functions such as body temperature and heart rate. Hypothyroidism results when the thyroid gland fails to produce enough hormones. Hypothyroidism may be due to a number of factors, including autoimmune disease. The most common cause of hypothyroidism is an autoimmune disorder known as Hashimoto's thyroiditis. Autoimmune disorders occur when your immune system produces antibodies that attack your own tissues. Sometimes this process involves your thyroid gland. Scientists are not sure why this happens, but it is likely a combination of factors such as your genes and an environmental trigger. However it happens, these antibodies affect the thyroid ability to produce hormones. The second cause is over-response to hypothyroidism treatment. People who produce too much thyroid hormone, that is known as hyperthyroidism, are often treated with radioactive iodine or anti-thyroid medications. The goal of this treatment is to get thyroid functions back to normal, but sometimes correcting hyperthyroidism can end up lowering thyroid hormones production too much, resulting in permanent hypothyroidism. The third reason is thyroid surgery. Removing all or large portion of your thyroid gland can diminish or halt hormone production. In that case, you will need to take thyroid hormone for life. Another reason is radiation therapy. Radiations used to treat cancers of the head and neck can affect your thyroid gland and may lead to hypothyroidism. Then comes medications. A number of medications can contribute to hypothyroidism. One such medication is lithium, which is used to treat certain psychiatric disorders. If you are taking medications, ask your doctor about its effect on your thyroid gland. Less often, hypothyroidism may result from a few more causes which I am going to tell you. Is congenital disease. Some babies are born with a defective thyroid gland or no thyroid gland. In most cases, the thyroid gland did not develop normally for unknown reason, but some children have an inherited form of the disorder. Often infants with congenital hypothyroidism appear normal at birth. There is one reason why most states now require newborn thyroid screening. Pituitary disorder. A relatively rare cause of hypothyroidism is the failure of the pituitary gland to produce enough thyroid stimulating hormone, that is known as TSH, usually because of a benign tumor of the pituitary gland. Pregnancy. Some women develop hypothyroidism during or after pregnancy, that is known as postpartum hypothyroidism, often because they produce antibodies to their own thyroid gland. Left untreated, hypothyroidism increases the risk of miscarriage, premature delivery, and preeclampsia, which is a condition that causes a significant rise in women's blood pressure during the last 3 months of pregnancy. It can also seriously affect the developing fetus. And another reason is iodine deficiency. The trace mineral iodine, found primarily in seafood, seaweed, plants grown in iodine-rich soil and iodized salt, is essential for the production of thyroid hormones. Too little iodine can lead to hypothyroidism, and too much iodine can worsen hypothyroidism in people who already have the condition. In some parts of the world, iodine deficiency is common, but the addition of iodine to table salt has virtually eliminated this problem in the United States. Now coming to the risk factors. Although anyone can develop hypothyroidism, you are at an increased risk if you are a woman and are older than 60, have a family history of thyroid disease, have an autoimmune disease such as type 1 diabetes or celiac disease, or you have been treated with radioactive iodine or anti-thyroid medications, or you have received radiation to your neck or upper chest, or if you have had thyroid surgery, that is partial thyroidectomy, or if you have been pregnant or delivered a baby within the past 6 months. So these are the risk factors which I just told you. Coming to the complications. Untreated hypothyroidism can lead to a number of health problems. These are goiter. Constant stimulation of your thyroid to release more hormones may cause the gland to become larger, a condition known as goiter. Although generally not uncomfortable, a large goiter can affect your appearance and may interfere with swallowing or breathing. Heart problems. Hypothyroidism may also be associated with an increased risk of heart disease and heart failure, primarily because high levels of low-density lipoprotein, that is LDL cholesterol, the bad cholesterol, can occur in people with an underactive thyroid. Mental health issues. Depression may occur early in hypothyroidism and may become more severe over time. Hypothyroidism can also cause slowed mental functioning. Peripheral neuropathy. Long-term uncontrolled hypothyroidism can cause damage to your peripheral nerves. These are the nerves that carry information from your brain and spinal cord to the rest of your body, for example, your arms and legs. Peripheral neuropathy may cause pain, numbness, and tingling in affected areas. Then there is a dangerous complication known as myxedema. This rare, life-threatening condition is the result of long-term, undiagnosed hypothyroidism. Its signs and symptoms include intense cold intolerance and drowsiness, followed by profound lethargy and unconsciousness. A myxedema coma may be triggered by sedatives, infection, or other stress on your body. If you have signs or symptoms of myxedema, you need immediate emergency medical treatment. Infertility is another complication. Low levels of thyroid hormone can interfere with ovulation, which impairs fertility. In addition, some of the causes of hypothyroidism, such as autoimmune disorder, can also impair fertility. Birth defects. Babies born to women with untreated thyroid disease may have a higher risk of birth defects compared to babies born to healthy mothers. These children are also more prone to serious intellectual and developmental problems. Infants with untreated hypothyroidism present at birth are at risk of serious problems with both physical and mental development. But if this condition is diagnosed within the first few months of life, the chances of normal development are excellent. Now, coming to the diagnosis of hypothyroidism. In general, your doctor may test for an underactive thyroid if you are feeling increasingly tired, have dry skin, constipation, and weight gain, or have had previous thyroid problems or a goiter. Blood test. Diagnosis of hypothyroidism is based on your symptoms and the results of blood tests that measure the level of TSH and sometimes the level of the thyroid hormone thyroxine. A low level of thyroxine and a high level of TSH indicate an underactive thyroid. That's because your pituitary produces more TSH in an effort to stimulate your thyroid gland into producing more thyroid hormones. Doctors can diagnose thyroid disorders much earlier than in the past, often before you experience symptoms. Because the TSH test is the best screening test, your doctor will likely check TSH first and follow with the thyroid hormone test if needed. TSH tests may play an important role in managing hypothyroidism. They help your doctor determine the right dosage of medications both initially and over time. In addition, TSH levels are used to help diagnose a condition called subclinical hypothyroidism, which usually causes no outward signs or symptoms. In this condition, you have normal blood levels of triiodothyronine and thyroxine, which are T3 and T4, but higher than normal levels of TSH. There are certain factors that can affect blood tests for thyroid problem. One is the blood thinning medication called heparin. Another is a biotin, a vitamin taken as a standalone supplement or as part of a multivitamin. Let your doctor know about any medications or supplements you take before having blood tests done. Now, coming to the treatment. Standard treatment for hypothyroidism involves daily use of the synthetic thyroid hormone levothyroxine, which comes with the name of Levo-T, Synthroids, and others. This oral medication restores adequate hormone levels, reversing the signs and symptoms of hypothyroidism. You will likely start to feel better soon after you start treatment. The medication gradually lowers cholesterol levels elevated by the disease and may reverse any weight gain. Treatment with levothyroxine will likely be lifelong, but because the dosage you need may change, your doctor is likely to check your TSH level every year. To determine the right dosage of levothyroxine initially, your doctor generally checks your level of TSH after 6 to 8 weeks. After that, blood tests are generally checked 6 months later. Excessive amounts of the hormone can cause side effects such as increased appetite, insomnia, heart palpitations, shakiness. If you have coronary artery disease or severe hypothyroidism, your doctor may start treatment with a smaller amount of medication and gradually increase the dosage. Progressive hormone replacement allows your heart to adjust to the increase in metabolism. Levothyroxine causes virtually no side effects when used in the appropriate dose and is relatively inexpensive. If you change brands, let your doctor know to ensure you are still receiving the right dosage. Also, do not skip doses or stop taking the drug because you are feeling better. If you do, the symptoms of hypothyroidism will gradually return. Certain medications, supplements, and even some foods may affect your ability to absorb levothyroxine. Talk to your doctor if you eat large amounts of soy products or a high fiber diet, or you take other medications such as iron supplements or multivitamins that contain iron, aluminum hydroxide, which is found in some antacids, calcium supplements. I mean that if you take these medicines, you should tell your doctor because they may affect the absorption of thyroid hormone, that is levothyroxine. Okay, levothyroxine is best taken on an empty stomach at the same time every day. Ideally, you will take the hormone in the morning and wait an hour before eating or taking other medications. If you take it at bedtime, wait 4 hours after your last meal or snack. If you miss a dose of levothyroxine, take 2 pills the next day. Subclinical hypothyroidism. If you have subclinical hypothyroidism, discuss treatment with your doctor. For a relatively mild increase in TSH, you probably won't benefit from thyroid hormone therapy, and treatment could even be harmful. On the other hand, for a higher TSH level, thyroid hormones may improve your cholesterol level, the pumping ability of your heart, and your energy level. Now I'll tell you some. There is an alternative medicine. Although most doctors recommend synthetic thyroxine, natural extracts containing thyroid hormone derived from the thyroid glands of pigs are available. These products contain both thyroxine and triiodothyronine. Synthetic thyroid medications contain thyroxine only, and the triiodothyronine your body needs is derived from thyroxine. Extracts are available by prescription only and should not be confused with the glandular concentrates sold in natural food stores. These products are not regulated by the Food and Drug Administration, and their potency and purity is not guaranteed. So generally, we encourage you to take synthetic thyroxine, which I told you, okay? Because these products are not regulated by FDA. I hope you like this video of mine, and if you are suffering from hypothyroidism or any other problem, please comment about your illness in the comment section of this video, and I'll try to reply to your comments as soon as possible. Also, if possible, if I get time, I'll try to make a video on your illness. Okay, so let me know in comment section. Also, if you have not subscribed my channel till now, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. Okay, and if you think my videos provide some sort of benefit to you, even if it is 5%, 10%, please like this video and share this video with your family and friends.